2 or 3 weeks, you will see a longer profile interview with Professor Butler airing on that network. Watch for it on Book TV, on C-SPAN 2. The House is now in session.
Prayer will be offered by our chaplain, Father Conroy.
Let us pray. Loving and gracious God, we give you thanks for giving us another day. We ask today that you bless the members of this assembly to be the best and most faithful servants of the people they serve. Purify their intentions that they will say what they believe and act consistently with their words. Help them. Indeed, help us all to be honest with themselves so that they will be concerned not only with how their words and deeds are weighed by others, but also with how their words and deeds affect the lives of those in need and those who look to them for support, help, strength, and leadership. May all that is done this day in the people's house be for your greater honor and glory. Amen.
The Chair has examined the journal of the last day's proceedings and announces to the House his approval thereof. Pursuant to Clause 1 of Rule 1, the journal stands approved. Pledge of allegiance today will be led by the gentleman from Washington, Mr. Kilmer.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The Chair will entertain up to 5 requests for 1-minute speeches on each side of the aisle. For what purpose does the gentleman from Colorado rise?
Speaker, I ask unanimous consent to address the House for 1 minute to revise and extend my remarks.
Without objection.
Mr. Speaker, this week I introduced legislation that will amend the Affordable Care Act, better known as Obamacare, to prohibit a bailout for the insurance industry that is currently authorized under Section 1341 and Section 1342 of the Affordable Care Act. The American people have had enough of big bailouts for big business, and it's time for this culture of corporate cronyism that has become a dominant part of Washington, D.C. to stop. My legislation, the No Bailouts for the Insurance Industry Act of 2014, would amend the Affordable Care Act to repeal Section 1341, the Reinsurance Fund, and Section 1342, the Risk Corridor provision. Together, both could provide for a massive taxpayer bailout to cover the insurance industry losses. The taxpayers should not be on the hook for the failures of Obamacare. Any reasonable person can see that this scheme isn't going to work, and the American people should not be forced to bail it out once it fails. Mr. Speaker, I urge the passage of the No Bailouts for the Insurance Industry Act of 2014, and I yield back.
The gentleman from Colorado's time has expired. The purpose of the gentleman from Washington rise.
Mr. Speaker, I ask unanimous consent to address the House.
Without objection.
Thank you, Mr. Speaker. I rise today to speak on the devastating loss of unemployment benefits for 1.3 million Americans already, and 1.9 million more at risk of losing benefits if Congress fails to act soon. I've heard from constituents across my region who will be impacted by this, including a veteran who's been unemployed for 8 months. Losing benefits will make it harder for him to complete the training program that he's enrolled in with the hopes of finding a new job. While our economy has made progress since the depths of recession, we still have too many people around this country struggling to find work. Congress needs to get focused on job creation, but withdrawing support to unemployed people as they seek work is no way to boost this economy. In fact, the Council of Economic Advisors estimates that failing to extend unemployment benefits will cost my state, Washington State, nearly 6,200 jobs. That's worth repeating. Doing nothing will cost us jobs. For the sake of middle-class families who've lost their jobs through no fault of their own, for the sake of economic recovery, we need to extend the emergency unemployment compensation program immediately. Thank you, Mr. Speaker. I yield back the balance of my time.
The gentleman's time has expired. For what purpose does the gentleman from Texas rise?
Ask unanimous consent to address the House for 1 minute to revise and extend my remarks.
Without objection.
Mr. Speaker, this week I got a call from a concerned father in Crosby, Texas. His daughter is a single working mom with 3 young children ages 3 through 13. She recently received bad news from her health insurance provider. She and her children would be dropped from their current plan. The new plan, required under Obamacare, had a 40% more expensive premium. As a result, she and her children had to move out of their home and in with their father and mother. She no longer can afford to make it on her own. The father said, quote, "Texans are suffering. It hurts us." She got a 40% increase in her premium payments while she's already struggling to make ends meet. Her policy was great before, but now it's gone. Mr. Speaker, this single working mom in Texas is being punished under Obamacare. The President sold Obamacare to the American people on the false promise that if they liked their plan, they could keep it. Now this single mother and her children and others are learning the hard way that this was just one more Washington lie. And that's just the way it is. I yield back.
The gentleman's time has expired. For what purpose does the gentlelady from Illinois rise?
Mr. Speaker, I ask for unanimous consent to address the House for 1 minute.
Without objection.
Thank you, sir. During my first year in office, I've made it a priority to put politics aside and focus on working with both Democrats and Republicans. My goal is to find common-sense solutions that benefit the people of my region of Illinois. I was encouraged to see both parties come together last month to pass a bipartisan deal that prevented another government shutdown, eased the harmful impact of sequestration, and protected Illinois jobs and the economy. But compromises are rarely perfect, and this budget is no different. It's not perfect. That is why I helped to introduce the Military Retirement Restoration Act. It would repeal the military retiree cost of living adjustments included in the budget deal. This bill is fully paid for and would repeal those cuts to military retirees by closing unfair tax loopholes for offshore corporations. As someone who will always honor and support those who have given their lives in service to our country, I will continue to oppose proposals that aim to balance our budget on the backs of brave men and women who have served us. I urge Democrats and Republicans to join me in supporting this common-sense effort to ensure our military retirees get the benefits that they have earned and deserve. Thank you, Mr. Speaker, and I yield back.
The gentlelady's time has expired. For what purpose does the gentleman from Virginia rise?
Speaker, I request unanimous consent to address the House for 1 minute and to revise and extend my remarks.
Without objection. To order.
Mr. Speaker, I rise today to express my support for the Military Exchange and Commissary Program. The Defense Commissary Agency in the Department of Defense operates an efficient worldwide chain of commissaries providing affordable groceries to military personnel and their families and retirees. This benefit is critical for the men and women of the military and their families. It helps military personnel adequately provide for their families' nutrition and well-being, both here at home and across the globe. While our federal budget is under pressure, the benefits to our military personnel must not be targeted as a means to reduce our national debt. The Exchange and Commissary Program is essential for retention, well-being, and our nation's military readiness. This is a vital service, and I will continue to fight for these services to be preserved here and especially across the globe. This program is critical to our nation's military readiness and must be maintained. And with that, Mr. Speaker, I yield back.
The gentleman yields back. For what purpose does the gentleman from Arizona rise? Without objection.
Thank you, Mr. Speaker. I believe we have a solemn duty to protect the privacy of all Americans. I think all of us here believe that, too. And I am committed to helping Southern Arizonans have access to the Affordable Care Act through the healthcare.gov website, and we must ensure that their personal and medical information is protected. That's why I'll be introducing the CARE Act, which will require that the Department of Homeland Security develop the highest cybersecurity standards for healthcare.gov, and for the Department of Health and Human Services to implement these standards within 90 days. In a recent hearing in the Committee on Homeland Security, we learned that too little has been done to protect the privacy of Americans accessing the website. My constituents and the people across this country deserve to know that when they interact with this website, that their personal information will be safe and secure, and that is what my bill ensures. I urge my colleagues, both Democrats and Republicans alike, to join me in support of this critical legislation. Mr. Speaker, I yield back.
The gentleman's time has expired. For what purpose does the gentleman from Georgia rise?
Mr.
Speaker, I request unanimous consent to address the House for 1 minute to revise and extend my remarks.
Without objection.
Thank you, Mr. Speaker. Nearly 4 years ago, the President signed into law his massive takeover of our health care system. And now Americans are seeing the lies and deceptions of Obamacare. They deserve better. Now more than ever, they're looking for a solution. Fortunately, there is a solution. It's H.R. 2900, My Patient Option Act. The Patient Option Act is the only health care bill that completely removes the government from the doctor-patient relationship and puts patients back in charge of their health care decisions. It will make health insurance cheaper for everyone. It provides access to good quality care for all Americans, and it will save Medicare from going broke. This week, I'm honored to announce that the Association of American Physicians and Surgeons has endorsed My Patient Option Act. With the support of associations like APPS and through the voice of We the People, we can work to put in place true conservative solutions like My Patient Option Act. Mr. Speaker, I yield back.
Gentleman's time has expired. For what purpose the gentleman from Florida rise?
Mr. Speaker, I ask for permission to address the House and permission to revise and
Extend my remark. Without objection.
Mr. Speaker, although the recent budget compromise has given our economy a measure of stability, and we are all thankful for that, it did so at the cost of vital military benefits to our families. The budget deal cut $6 billion by reducing crucial cost of living adjustments, COLAs, for thousands of veterans in South Florida and across the country. This is a minuscule part of the federal deficit, less than 0.1%, but it makes a huge difference for those who have given so much. Cost of living adjustments help seniors and veterans keep up with the rising costs and the basic needs like groceries and clothing. There are a lot of places to cut the federal deficit, a lot of places. But it shouldn't be in aiding those men and women who've sacrificed so much. That's why I've co-sponsored legislation to repeal this cut, and I urge my colleagues to join me in support of our nation's heroes. I yield back the balance of my time.
The gentleman from Florida yields back. What purpose does the gentleman from Pennsylvania rise?
Address the House for 1 minute, provide extend.
Without objection.
Mr. Speaker, it has been more than 50 years since President Johnson declared war on poverty. I don't doubt that President Johnson had good intentions, but intentions don't win wars, and poverty is a stubborn opponent. 15% of Americans still live below the poverty line after trillions spent by the government. In December, I brought together community leaders and national experts to discuss how we can reinvigorate the city of Reading and other cities in the 16th District of Pennsylvania. And from this conference, we're moving forward to get institutions to work together strategically and think differently about attacking the problem. Government at every level and community leaders need to cooperate, make sure there are opportunities to start new businesses and attract more development. Perhaps most importantly, we need smart strategies to help kids get a good education, and this has to include building strong families, since statistics show that children raised by only one parent are far more susceptible to temptations of drugs and gangs and other problems. It's time we rethought our strategy, rededicate ourselves to truly helping needy Americans by removing barriers for wealth creation. I yield back.
Gentleman's time has expired. For what purpose the gentleman from California rise?
Mr. Speaker, I ask for unanimous consent to address the House for 1 minute to revise and extend my remarks.
Without objection.
Thank you,
Order.
Mr. Speaker, I rise today to urge my colleagues to extend the critical unemployment insurance lifeline to the 1.3 million Americans who have already lost coverage. Tragically, another 1.9 million Americans are set to lose benefits over the first 6 months of this year if we do not act. In California alone, over 214,000 people have already lost their unemployment coverage, including 19,000 people in San Diego County and 3,500 people in Imperial County. Approximately 326,000 more Californians stand to lose their coverage in the first 6 months of 2014. With unemployment unacceptably high, now is not the time to take money out of the pockets of those who are struggling. For jobless Americans, unemployment benefits are used to purchase basic lifeline needs like food and shelter and immediate necessities. The time is clicking. Let's do the right thing. Mr. Speaker, I yield back. Thank you very much, sir.
The gentleman yields back.
Looks like it's back to New Jersey.
For what purposes does the gentleman from Pennsylvania seek recognition?
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days to revise and extend their remarks and to include extraneous material on H.R. 3811.
Without objection, so ordered.
Mr. Speaker, pursuant to House Resolution 455, I call up H.R. 3811 and ask for its immediate consideration in the House.
Clerk will report the title of the bill.
H.R. 3811, a bill to require notification of individuals of breaches of personally identifiable information through exchanges under the Patient Protection and Affordable Care Act.
Pursuant to House Resolution 455, the bill is considered read. The gentleman from Pennsylvania, Mr. Pitts, and the gentleman from New Jersey, Mr. Pallone, will each control 30 minutes. The chair recognizes the gentleman from Pennsylvania.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Mr. Speaker, in the days leading up to Christmas, hackers stole millions of credit card numbers from the servers of retail giant Target. I imagine that at least a few here in this chamber may have had their own credit cards replaced to prevent theft. What if Target had not bothered to tell anyone? What if they had waited until people noticed fraudulent charges popping up on their statements? The damage would certainly be worse. It may shock some people to learn that there is no legal requirement that the Department of Health and Human Services notify an individual if his or her personal information is breached or improperly accessed through the Affordable Care Act's exchanges. While HHS has said that it will notify individuals in such a case, the American people have a right to know that their government is required by law to contact them if their personal information is compromised. H.R. 3811, the Health Exchange Security and Transparency Act, would simply ensure Americans receive notification from HHS when their personally identifiable information has been compromised through the exchanges. Specifically, the bill requires HHS to notify individuals no later than 2 business days after discovery of a breach of an exchange system. Since the disastrous rollout of the healthcare.gov website, congressional oversight has uncovered that end-to-end security testing of healthcare.gov did not occur before the October 1st launch, and that high-ranking administration officials were told of the security risk before the website went live. Teresa Fryer, the Chief Information Security Officer for the agency running the exchange system, even stated in a draft memo that the federal exchange, quote, does not reasonably meet security requirements, and there is also no confidence that personal identifiable information will be protected, end quote. A recent article in Information Week discussed a report released by Experian entitled 2014 Data Breach Industry Forecast, which stated that, quote, the healthcare industry by far will be the most susceptible to publicly disclosed and widely scrutinized data breaches in 2014. According to Information Week, the author of the study said he is basing this prediction at least partly on reports of security risk posted by the healthcare.gov website, and the health insurance exchanges established by various states. The web infrastructure to support health insurance reform was, quote, put together too quickly and haphazardly, end quote. The most glaring problem for these sites has been their inability to keep up with consumer demand. The organizational infrastructure behind the implementation of Obamacare is also complex, meaning that many parties have access to the personal data and could misuse or mishandle it. Quote, so we have volume issues, security issues, multiple data handling points, all generally not good things for protecting protected health information and personal identity information, end quote. Given the lack of security testing and the risk associated with healthcare.gov and the administration's repeated misrepresentation of the website's readiness and functionality, H.R. 3811 is a reasonable step to ensure federal officials are required to notify individuals in case of a breach. Thank you, and I reserve the balance of my time.
The gentleman reserves. The gentleman from New Jersey is recognized.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Thank you. First of all, Mr. Speaker, I want to point out that Republicans are using out-of-context quotes from an administration or from administration officials to mislead the public about the security of healthcare.gov, the website. The same official they keep quoting went on to say, and I quote, "The added protections that we have put into place are best practices above and beyond what is usually recommended." And no website is 100% secure, but this effort to scare people from signing up for coverage is simply wrong. Mr. Speaker, I'm afraid the bill before the House today is simply an effort by Republicans to continue to impede the efforts of implementing the Affordable Care Act by instilling misinformation and fear in the American public. It's an egregious bill that would, in my opinion, let me point this out, Mr. Speaker. Yesterday I was in the Rules Committee, and I pointed out that to some extent I was pleased, I guess, that I don't see the Republicans actually coming to the floor today to act on another repeal or outright repeal of the Affordable Care Act. I mean, we're not seeing that. We didn't see it in rules, and hopefully I'll say to my colleague, the chairman of the Health Subcommittee, that we don't see it again either in the committee, in rules, or on the floor. So maybe there's some progress here, and at least the Republicans are not out there trying to repeal the Affordable Care Act anymore. At least I hope so. But they're now moving to these other methods of trying to put fear into the public so that they don't sign up or they don't go on the website. And the fact of the matter is that these security measures that they're talking about are addressing a reality that's not there. Do I think that security measures are critical for the website? Yes, absolutely. But let's recap the last few years since the ACA passed. Republicans claim the ACA kills jobs, but since the law has passed, we've added nearly 8 million jobs. Republicans claim that the ACA causes health costs to increase, but the last 4 years we've seen the slowest health care cost growth in 50 years. Republicans claim we need to address the deficit, but yet they repeal the law at every turn, which increases the deficit by over $1.5 trillion. And now they say the healthcare.gov is going to result in widespread breaches of people's personal information, and that's simply not true. There have been no successful security attacks on healthcare.gov, and no one has maliciously accessed personal information. No website, public or private, is 100% secure, but healthcare.gov is subject to strict security standards. It's constantly monitored and tested, and its security and privacy protections go beyond federal IT standards. And the Health and Human Services Department has standards in place, just like every other government agency, to notify individuals if their personal information is breached. So, Mr. Speaker, it's important that I know for everyone that House Democrats have always previously supported legislation to require consumer notification in the event of a breach of government and private sector computer systems. We still do. By expressing concern for the mockery of this bill, it does not mean that I don't support requiring the administration to notify individuals of breaches of their information, but this is not a serious effort to strengthen privacy laws or to strengthen the health care website. The Republican strategy is to scare people away from going to the website and signing up for health care, and I urge members and the American public, do not be fooled by what they're doing. It's a good thing that they're not seeking to outright repeal the Affordable Care Act anymore. At least that appears to be the case based on what happened in rules the other night. But that doesn't mean that they're not going to continue with these efforts to try to make hay over security and other matters. And, you know, I can't stress enough that every one of the scare tactics they use, whether it's saying that, you know, the ACA is going to increase the deficit, which it doesn't, it actually decreases the deficit, or whether they say that it's going to increase health costs, which we know it doesn't, it actually decreases health costs. This is just another one of those scare tactics, and I just hope that my colleagues, both Democrats and Republicans, are not fooled by this. So I reserve the balance of my time, Mr. Speaker.
Gentleman from New Jersey reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this time, I'm pleased to yield 2 minutes to the distinguished chairman of the Oversight and Government Reform Committee, Mr. Issa of California.
The gentleman from California is recognized for 2 minutes.
Thank you, Mr. Speaker. Famously, Franklin Delano Roosevelt said, "We have nothing to fear but fear itself." That's not true here, and sadly, the last speaker is entitled to his opinion, but the facts do not bear out his conclusions. The truth is that actual interviews and depositions taken of the highest-ranking people that helped develop this website, both public and private, shows there was no end-to-end testing. It did not meet the spirit of any definition of a secure website. In fact, the highest-ranking person, Teresa Fry, on September 20th, was unwilling to recommend this site to go active and said under oath that if it had been within her authority to stop it, she would have. It is very clear, even from the White House's statements in the last few days, that they claim to have mitigated or have a plan to mitigate significant security risk. The American people need to understand a plan to mitigate means they have not mitigated security risk. This is the situation we're in which no private sector company, including Target, would go live with a system that has known failures and unknown failures because of a failure to do end-to-end. All we are asking for is, since Secretary Sebelius, under oath, has been wrong on multiple occasions, and I've called for her to make clear that she made false statements, the fact is, what we need is a law that makes it clear that they should do the right thing, not say they have always done the right thing and they will do the right thing, because in the case of healthcare.gov, they launched a site that was neither functionally ready nor had it been security tested, and it had known failures that were not mitigated prior to the launch. Those are the facts, Mr. Speaker, and I ask for support of this bill.
The gentleman's time has expired. The gentleman from Pennsylvania reserves. Gentleman from New Jersey.
Mr. Speaker, I yield 3 minutes to the gentlewoman from Colorado, Ms. DeGette.
Gentleman from Colorado is recognized for 3 minutes.
Thank you, Mr. Speaker. Some mornings in Congress I wake up and I say, now here's a solution in search of a problem, and this morning is one of those days. We are hearing about how the website's not secure, how there can be security breaches. Ironically, we're hearing about security breaches with a private company, Target, and how terrible it is, and that's why we have to do a bill. But in fact, we haven't seen any security breaches with healthcare.gov or the websites around the Affordable Care Act. And I want to stress that. I'm the ranking Democrat on the Oversight and Investigation Subcommittee of Energy and Commerce, and we've had a number of hearings and we've had classified briefings. And here's some information that is not classified information. There has been not one successful hack into healthcare.gov. Let me say that again. Nobody has successfully been able to breach healthcare.gov. Furthermore, as we recently learned in a briefing, healthcare.gov, interestingly, has not been targeted any more than any other federal website for hackers. So why are we doing this bill? I've got to associate myself with my ranking member's comments, Mr. Pallone, that the only reason we could be doing this bill is to try to have a chilling effect against people signing up to get health insurance through the websites. And so let me say again, there have been no successful breaches of healthcare.gov. Now, if we really wanted to do a bill that would strengthen privacy, I would be all for that. I think that consumer privacy is one of the most important things we can do. But really, when you look at the details of this bill, there's nothing here that furthers consumer notification or consumer privacy. First of all, there's no exemption or consideration of law enforcement. What if law enforcement found a potential breach and needed to investigate it? What if they needed more than 48 hours to make sure that, in fact, there was a breach before they notified people? Consider the harm that would occur if law enforcement did not have enough time and resources to fully investigate a security breach before it went public. The consequences of hasty and incorrect notification could just make the problem worse. Secondly, based on how the bill is drafted, if there's a data breach in a state that's chosen to run its own exchange, like my home state of Colorado, HHS seems to bear an unnecessary burden of reporting the breach in the state exchange, having nothing to do with the federal exchange. Might I remind my colleagues, state exchanges are entirely independent from healthcare.gov. HHS does not run them. HHS did not build their websites. And HHS did not develop their security protocols. So why should HHS have to get involved in these state exchanges? I ask for an additional minute, Mr. Chairman.
An additional minute to the gentleman.
Thank you.
The gentlelady is recognized for an additional minute.
Thank you. So security for these state-based exchanges should be the responsibility of the states that are running them. I could go on and on. There are more problems with this bill than pages in the bill. So let's get real. Instead of bringing legislation like this to the floor without any committee action, why can't we sit down together in a bipartisan way and improve the way the Affordable Care Act works for our constituents? That's what our constituents want. They want affordable health insurance, they want health care, and they don't want unwarranted scare tactics and attacks. So let's sit down, let's work together, let's fix this legislation, and let's get real. I yield back.
Gentlelady yields back. Gentleman from New Jersey reserves. Gentleman from Pennsylvania.
Mr. Speaker, I'm pleased this time to yield 2 minutes to the distinguished gentlelady from Tennessee, Ms. Black, who's an expert on this issue.
Gentlelady from Tennessee is recognized for 2 minutes.
Thank you, Mr. Speaker. And I rise today in support of this legislation to provide basic diligence to the federal Obamacare exchange. If someone's personal information has been breached, the federal government should be accountable and be required to notify them so that they can protect themselves from either identity theft or cyber threats. This is common sense. As data breach notification is required on most of the state-run exchanges, and there are laws that require information that has been breached by private businesses to notify people as well. Yet, when HHS was asked to insert notification provisions into the final rule for Obamacare, they specifically declined to do so. This is an astonishing failure on the part of the administration that is sadly characteristic of how they have proceeded at every turn with the implementation of this train wreck legislation. Healthcare.gov has been described by the former Social Security Administrator Michael Askew as a hacker's dream, and last month HHS reported that there had been 32 security incidences since its launch. The federal exchange potentially puts at risk Americans' names, addresses, phone numbers, dates of birth, email addresses, and even Social Security numbers. Last month, I introduced similar data breach notification legislation, and I'm pleased to join my House colleagues now to pass this important bill. Mr. Speaker, I can't imagine explaining to my constituents that I voted against this common-sense measure to protect the hard-working Americans from identity theft and cyber attacks. And this is why I urge my colleagues to support this bill. I yield back the balance of my time.
The gentlelady yields back. The gentleman from Pennsylvania reserves. The gentleman from New Jersey.
Mr. Speaker, I yield 3 minutes to the ranking member of the House Committee on Oversight and Government Reform, the gentleman from Maryland, Mr. Cummings.
I thank the
gentleman from Maryland is recognized for 3 minutes.
Thank you very much, Speaker. I thank the distinguished gentleman from New Jersey for yielding. I'd like to make 2 very, very simple points. First, the Affordable Care Act is working. Hello, it is working. It went into full effect, if you didn't know, on January 1st. And now millions of people are getting health insurance they did not have before. Imagine what this means to families. Not only are they receiving critical medical care, but they have the security of knowing they will not go bankrupt if they get into an accident or they get sick. That's major. The law also put in place key protections for consumers. Insurance companies are now prohibited from discriminating against people with cancer, diabetes, or other pre-existing conditions. And some young people in my district said, well, Congressman, I'm not worried about pre-existing conditions. I told them, you just keep on living. They may not charge higher prices for women. And millions of people are now receiving free preventative care. There are also huge financial benefits. Health insurance companies are sending rebate checks to millions of people. Since the law was passed, we have seen the lowest growth in health care costs in 50 years. And if we repealed the law today, it would increase our deficit by more than $1.5 trillion. Despite all of these positive results, Republicans are still obsessed with killing the law. Since they cannot do it legislatively, they have shifted to a different tactic, scaring people away from the website. So my second point is this. There have been no successful security breaches of healthcare.gov. Let me say that again. There have been no successful security breaches of healthcare.gov. Nobody's personal information has been maliciously hacked. All week, Republicans have been trying to make their case for this bill by quoting from a memo drafted by the Chief Information Security Officer at CMS about concerns before the website was launched. But they omit one critical fact. This official never said the memo. It was a draft, and she never gave it to anyone, including her own supervisor. How do we know this? Because she was interviewed by the Oversight Committee, both Republican and Democratic staff, weeks ago. Can I have one more minute?
I yield the gentleman an additional minute.
The gentleman from Maryland is recognized for an additional minute.
And she told us this herself. Her draft memo did not take into account mitigation strategies put in place days that followed. Importantly, she also told the committee she is satisfied with the security testing being conducted. When asked to describe the security measures now in place, she called them, and I quote, best practices above and beyond what is usually recommended, end of quote. These are important facts for the American people to know. But the Republicans disregard them and omit them because they want to undermine their claims. Many of us would support efforts to strengthen requirements for the entire federal government and private sector to notify consumers of breaches. But today's bill does not do that. Today's bill is the latest attempt to attack the Affordable Health Care Act and deprive millions of Americans of the health care they deserve. And with that, Mr. Speaker, I yield back.
Gentleman's time has expired. The gentleman from New Jersey reserves. The gentleman from Pennsylvania.
Mr. Speaker, at this time, I'm pleased to yield 1 minute to the distinguished whip. of the House, Kevin McCarthy of California.
Gentleman from California is recognized for 1 minute.
Thank you, Mr. Speaker. I rise today in support of the Health Exchange Security and Transparency Act. The reason why we are passing this important legislation today is that credible and documented fears have been raised that this hastily constructed Obamacare exchange websites could jeopardize the security of our most sensitive personal information. One of the many reasons so many worry about Obamacare is that it injects government and government bureaucrats into the most personal sphere of our lives, our health care, in new and alarming ways. Nothing can turn a life upside down more quickly than identity theft. It is our duty as members of Congress to do everything in our power to protect and inform Americans about these potential devastating events. I am confident that this one is one of the law's most negative consequences that both sides of the aisle can come together and agree and must be addressed. Absent its full repeal, instilling this type of transparency and accountability into Obamacare is a worthy first step. I urge my Democratic friends to join with us today, and I yield back the balance of my time.
Time has expired. Gentleman from Pennsylvania reserved. Gentleman from New Jersey.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Mr. Speaker, Republicans continue to attack the website, healthcare.gov, and this attack on the security of the website is just the latest in a long line of scare tactics attempting to limit enrollment and coverage under the ACA. It just bothers me so much because, as you know now, we have, I think, about 6 million people who have obtained coverage, 2.1, private insurance through the website. And things really are moving now in terms of more and more people signing up and getting coverage. I just wish that rather than use these scare tactics and try to talk about security concerns that don't exist, that they would focus and work with us in actually trying to sign people up and get people to have health insurance, which is the goal, of course, of the Affordable Care Act. The bill suggests that there are serious security problems at healthcare.gov, but by establishing this unique requirement, which doesn't apply to other government websites or to private websites, and the HHS is required to notify individuals within 2 business days if their personal identifiable information is known to be stolen or unlawfully accessed from a marketplace computer system. If this is a good idea, why is the GOP bill limiting this requirement to only marketplace websites? It's just a missed opportunity. Democrats firmly support strong data security and breach notification legislations. If the Republicans were serious about the security of personally identifiable information on the web, instead of bringing up this bill, they could have reached out to Democrats and developed a bipartisan bill. Indeed, when Democrats were in the majority, the Democrat-run House passed bipartisan legislation to provide for consumer notification in the event of a breach, was introduced in the previous Congress. And the Republicans are still playing political games. If they want to work with us to bring to the floor a serious bipartisan data security and breach notification legislation, then they should simply do it. In the Rules Committee the other day, one of the members asked on the Republican side if the administration has a position on the bill, and the administration clearly opposes the bill. They put out an SAP which states that the administration believes personally identifiable information should be protected wherever it resides and that all Americans deserve to know if that information has been improperly exposed. The federal government has already put in place an effective and efficient system for securing personally identifiable information in the health insurance marketplace. So they oppose passage of this bill. I just wish I could convince my colleagues. Again, I'm happy that this is not an outright repeal, and we're not wasting time on that. But we're still wasting time with this notion of a security breach that hasn't happened when security measures are already in place. And again, this is being brought up in the first week we're back. No effort to reach out to us in any way to try to deal with this. It has a 2-day notification requirement, which is simply not workable. I cannot stress enough that we as Democrats would like to address this issue, but it's not being addressed. It's just being done as a way of trying to fear the public, scare the public into signing up on the website, which is so unfortunate because people want to sign up. They shouldn't be in fear that if they sign up, somehow there's going to be a security breach. I will reserve my time.
Gentleman from New Jersey reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 4 minutes to a distinguished member of the Health Subcommittee, Mr. Bill Raucus from Florida.
The gentleman from Florida is recognized for 4 minutes.
Thank you, Mr. Speaker. Thank you, Mr. Chairman. I appreciate it very much. Mr. Speaker, I rise today in support of the Health Exchange Security and Transparency Act. I'm pleased to be an original co-sponsor of this legislation, and I'm glad we're addressing this very important issue on the House floor today. Each day I hear from constituents in Florida's 12th congressional district who are experiencing the negative impacts of Obamacare. Contrary to the very promises the law was sold on, my constituents have lost their health care coverage, have seen their premiums rise, and were forced to choose new doctors. Now they're faced with concerns regarding their personal information and whether it is compromised, all because the President's signature law was never really ready for prime time. The Energy and Commerce Committee, which I'm a member of, has held numerous hearings into the failed website and the lack of testing that occurred to ensure the website was properly secured. In these hearings, we have learned that 30 to 40% of the website isn't built. End-to-end security testing wasn't performed. CMS's own Chief Security Information Officer recommended against an authority to operate because of cybersecurity concerns. Her memo even stated there is no confidence that personal identifiable information will be protected. And it was the administrator of CMS, not the Chief Information Officer, that signed off on the ATO. Mr. Speaker, does this sound like a safe and secure website? Millions of Americans were forced to sign up for the exchanges in order to avoid individual mandate fines. And now each of these individuals, including myself and many in this chamber, are potential victims of identity theft. While privacy in the healthcare realm is typically protected by HIPAA, it does not apply to HHS or the federally run exchanges. Furthermore, data notification is critical to maintaining security, and individuals should be notified when their personal information could be compromised. Yet in the final rules HHS published in August, it did not finalize a data breach notification rule. Instead, it stated that it is up to CMS to determine whether a risk of harm exists and if individuals need to be notified. A government bureaucrat, Mr. Speaker, should not be given the power to determine whether the loss of personally identifiable information constitutes harm. We do not know how many breaches have occurred on healthcare.gov, whether due to the accidental sharing of information or otherwise, because there is currently no public disclosure requirement. The Health Exchange Security and Transparency Act will bring accountability and transparency to the administration and the health care exchanges. I strongly urge my colleagues in the House to support this bill today, and I urge all, of course, our colleagues in the Senate to swiftly take up this bill so that we may pass it into law. I thank you, Mr. Speaker, and I yield back.
The gentleman from Florida yields back. The gentleman from Pennsylvania reserves. The gentleman from New Jersey is recognized.
Thank you, Mr. Speaker. I yield such time as he may consume to the ranking member of the Energy and Commerce Committee, Mr. Waxman.
The gentleman from California is recognized for as much time as he may consume.
Thank you very much, Mr. Speaker. The previous speaker in this debate said we don't know how many times there was a breach of security on the health care website. Well, we do know how many breaches of security there were, how many successful attacks there were. 0. There have been no successful breaches of healthcare.gov. Mr. Speaker, since October 1, more than 6 million Americans have signed up for health insurance. 6 million. 4 million are enrolled in Medicaid, 2 million in private coverage. Any way you look at it, that's good news. Now Republicans seem eager to find some bad news. They want to keep talking about website problems and stir up phony fears that personal information is not secure on this site. They're looking for the bad news because the facts are against them. Republicans said the Affordable Care Act would kill jobs. We hear it over and over again, kill jobs. But since the law was passed, we have added nearly 8 million jobs. Republicans said this law would cause health care costs to skyrocket, but we've had 4 straight years of the slowest health care cost growth in 50 years. Republicans said the ACA would explode the deficit, but repealing the law, which they've tried to do over 40 times on this floor, would increase the deficit by over $1.5 trillion. So today, House Republicans are resorting to scare tactics. They're bringing up a poorly thought-out bill based on false premise that healthcare.gov is not secure. The truth is, I'll say it again, there have been no successful security attacks on healthcare.gov. Now, while no site, public or private, is 100% secure, healthcare.gov is subject to strict security standards. It's constantly monitored and tested. It has procedures in place to notify consumers in the event of a breach. We can't say the same thing for private websites. We all heard about Target having their website attacked successfully. No one's asking that they make disclosures. And in fact, Mr. Speaker, this is not a serious attempt to address this issue because it doesn't set any standards on private insurance companies. Private insurance companies hold far more private data than the exchanges. Mr. Speaker, as chairman, I worked on bipartisan legislation to set tough data privacy and security standards on government and private sector computer systems. House Democrats have supported these efforts. But this bill is not serious. Did you know this bill was never even considered in committee? It doesn't allow for any delay in reporting to protect ongoing law enforcement investigations. The bill creates a host of technical and administrative problems. This is purely a message bill. That's all we do these days. In between recesses, we have message bills on the floor of the House, and we get nothing done. This is purely a message bill, and the message is one that is designed to mislead. I urge a no vote.
Gentleman yields back. Gentleman from New Jersey reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 1 minute to our distinguished Majority Leader, Eric Cantor of Virginia.
Gentleman from Virginia is recognized.
Thank the Speaker, and I thank the gentleman from Pennsylvania. Mr. Speaker, I want to rise in support of the Health Exchange Security and Transparency Act, and if I could just take a few seconds to respond to the allegations put forward by the gentleman from California, the ranking member on the Energy and Commerce Committee. I want to just make a point, Mr. Speaker. There is a real difference between users of a retailer's website and users of healthcare.gov, because those who choose to go on a website of a retailer in the private sector do so at their choice. The people of this country, all of the American people now, if they go to healthcare.gov, they are being forced to go to healthcare.gov. And so for the gentleman to sit here and say, well, we don't require this, that, or the other of industries or banks or anything else, which I would beg to differ. There are certainly requirements at law and duties owed by banks to their shareholders, customers, and the rest. But I would say to the gentleman, this is a situation where the law at hand is requiring individuals, mandating them to go to this site. And so contrary to the allegations made by the gentleman, what this bill does is it just asks the administration, it requires it to provide 48 hours notice within a breach of health care information, financial data. All it says is the administration has to let victims of identity theft or information theft to be notified. That's it. This is a good government bill. Why do we want to wait until there is a data breach? You know, I would ask the gentleman to look to a quote by CMS's own Chief Information Security Officer, Teresa Fryer. She said, quote, the healthcare industry by far, she said, the federal exchange does not reasonably meet security requirements. That's what the Chief Cybersecurity Officer at the agency says. The exchange does not meet security requirements. Now, the Experian Credit Bureau said the healthcare industry by far will be the most susceptible to publicly disclosed and widely scrutinized data breaches of 2014. If we know this, why wouldn't we take precautions to help people? That's all this bill does. Is it says if there is a risk of data breach, we should afford people opportunity to take corrective action immediately. That's it. There's no message in there. This is just trying to help people. So I would say to the gentleman, if he would just set aside the partisan attacks for once, let's help people. Let's go about the way we should be and putting people first here. We disagree on this law and requiring health care the way government says we should require, yes. But I think we can all agree we want to help people and we want to make sure that they can keep their information safe. That's all this bill is about. So I want to thank Chairman Fred Upton, Chairman Joe Pitts, and the members serving on the committees who have been conducting oversight on the issue for the past year, including the Science Committee, the Homeland Security, and the Oversight and Government Reform Committees. Congresswoman Diane Black, certainly the gentleman from Florida, Gus Bilirakis, and Representative Kerry Benevolio have all worked hard on this issue. I commend them for their efforts to just help people for once. And with that, I urge adoption and passage of the bill, and I yield back.
The gentleman yields back. The gentleman from Pennsylvania reserves. The gentleman from New Jersey is now recognized.
Mr. Speaker, I yield such time as he may consume to Mr. Waxman.
Well, thank you for yielding. I'm not going to take that much time.
Recognized for as much time as he may consume.
Mr. Speaker, I'm not going to take that much time, but I do want to respond to the comments that were just made on the House floor. No one is forced to go on this website. No one is forced to buy their insurance by going on the website. They could go to brokers. But once you sign up for insurance, whether it's public or private, your information is in their web. It's in their computer system. And that is true for private insurance. Does this bill do anything about breaches of private insurance? No. Now, the majority leader used a quote from someone in the administration, I think, to mislead the public about the security of the healthcare.gov. But that same official said that the same official said at the end of that quote, the added protections that we put into place are best practices above and beyond what is usually recommended. No website is 100% secure, but this effort to scare people from signing up for coverage is wrong. If we do care about breaches in security, it ought to apply to private and public insurance, not just when you sign up, but when they hold your data. Thank you. Yield back.
Gentleman yields back. Gentleman from New Jersey reserves. Gentleman from Pennsylvania is recognized.
Mr. Speaker, at this time I'm pleased to yield 3 minutes to the distinguished Chairman of the Energy and Commerce Committee, gentleman from Michigan, Mr. Upton.
The gentleman from Michigan is recognized for 3 minutes.
Well, thank you, Mr. Speaker. I rise in strong support of this legislation, H.R. 3811, the Health Exchange Security and Transparency Act of 2014. Security and transparency, both are critically important to every American, and the public expects and deserves to have them both when it comes to health care. Sadly, I believe the administration has failed to deliver. This important bill seeks to provide peace of mind to folks in Michigan and across the country who have submitted personal information to a federal health insurance exchange. Americans have the right to know in the event that their sensitive personal information provided to an exchange is compromised, especially as it is the law's individual mandate that forces them to purchase the government-approved health care coverage. Why wouldn't we want the public to know and be alerted right away? Just this morning on CNBC, breaking news, CEO of Target apparently is indicating that as many as 70 million Americans their customers may have had their private information stolen, would it have been right for Target just to sit on that information? Or was it appropriate for them to try and put the word out so that they at least, the consumers have the right information? Let me tell you what this bill does. It's a common sense bill. It's going to require that the administration promptly inform individuals within 2 business days if their personal information has been stolen or unlawfully accessed through an exchange. And through the Energy and Commerce Committee's thoughtful oversight, we have uncovered troubling information regarding the security of the health laws exchanges. So what this bill does, it's preventive medicine. Do we want to wait until the horse is out of the barn before we take action? I don't think so. We found that the administration did not perform a full security control assessment before healthcare.gov opened for business on October 1st. We've also learned that just days before healthcare.gov went live, senior officials at HHS expressed serious concerns regarding the protection of personally identifiable information that was entered into their website. These facts, on top of the fact that the administration has repeatedly misrepresented the functionality and the readiness of the health care law, raise significant questions regarding the security of healthcare.gov and the information available in the exchanges. A few weeks ago, the administration was willing to let millions of Americans lose their health insurance, despite the President's solemn promise that they could keep their health plan if they liked it. And it took the House, acting in a bipartisan legislative manner, for the administration to confess that, yes, it had broken their promise. Now the administration is saying it opposes this requirement, that it notify Americans when personal information is stolen. The self-proclaimed most transparent... Could I have an additional 30 seconds?
You have an additional 30 seconds.
The gentleman recognized for an additional 30 seconds.
So the self-proclaimed most transparent administration in history has come out against transparency. I'm sorry. Republicans